Okay, let's talk about gallstones today. Dr. Bob Ganz, and I could spend an hour on this topic because when I was at Northwestern doing my fellowship, the chair of the department, Don Ostro, was a gallstone guru, so I learned a lot about gallstones. Let's talk about just a few things today. So when you get gallstone pain, gallstone-induced pain is typically central. We talked yesterday about some things that cause central discomfort. Gallstones, when you get biliary colic, in other words, when the gallstone blocks the outlet to the gallbladder secretes bile into the intestine, helps us digest our food. When a gallstone blocks that outlet, blocks what's called the cystic duct, then the gallbladder starts to distend, and that causes pain. That pain is central. Biliary colic without cholecystitis, inflammation of the gallbladder wall. Biliary colic is central. It's lower chest and the upper abdomen, mid-epigastrium. Not a lot of people realize that. A lot of people think gallbladder pain is right upper quadrant. No, gallbladder pain is typically central. Lower substernal area and upper abdomen is very important. So the typical presentation for gallbladder disease is you get a gallbladder attack, you're feeling fine, you get a gallbladder attack, it's central discomfort associated with nausea and vomiting. This lasts for several hours, and then the gallstone falls away from the cystic duct and the episode relents, and then you're fine for days, weeks, months, years. Then you get a second attack, biliary colic, central discomfort, nausea and vomiting, and then that pattern repeats. That's classic gallbladder attack. Right upper quadrant pain occurs only when you get a prolonged blockage and the gallbladder wall starts to get inflamed. You get peritoneal inflammation. The tissues around the gallbladder start to get inflamed, and that localizes it to the right upper quadrant. If you have gallstone attack and it's localized to the right upper quadrant, that's a very late gallbladder attack. That's a real emergency, and you need to go to the hospital for that for sure. Central pain with nausea and vomiting, several hours of discomfort, gets better, you wait a period of time, comes back again. That's classic gallbladder attack, biliary colic, okay? Very important to know that. Now, when you get biliary colic, you should go see your physician. They'll get an ultrasound, see gallstones, classic history. Typically, you get your gallbladder out. Now, the risk factors for gallbladder disease, there's two types of gallstones that you can get. You get pigment stones or cholesterol stones. Cholesterol stones are about 80%. We'll just talk about cholesterol stones today. So cholesterol stones are made of cholesterol and bilirubin and phospholipid, lecithin. The bilirubin and lecithin keeps the cholesterol crystals in solution. Anything that causes those cholesterol crystals to precipitate out of solution can cause formation of a gallstone, okay? So anything that increases cholesterol secretion. So that's rapid weight loss, female status, being overweight. It's funny, being overweight can cause increased cholesterol secretion, but rapid weight loss can also cause increased cholesterol secretion. Pregnancy can do it, certain age, over the age of 40. So the famous mnemonic for us in medical school is female, fertile, over 40, and fat. It's not nice to say fat today, so overweight. But that's the classic mnemonic for gallbladder disease. A lot of times biliary colic will occur in the middle of the night. Why? Because when you sleep, you're typically fasting, and fasting causes cholesterol to precipitate out of solution. So that's the primer on gallbladder disease today. Now, when you get your gallbladder out, and I see this a lot, you can frequently get diarrhea. Why? Because the gallbladder stores bile, and if you're not storing bile, then that bile is constantly circulating in the GI tract, and you can get bile salt-induced diarrhea or choleritic diarrhea. And I see this all the time, and unfortunately it's not recognized a lot. So I see a lot of patients in the office, they've had their gallbladder out and they have diarrhea for years, and nobody tells them, oh, it's because your gallbladder's out. So you put them on a bile salt binder. Saw a lady in the office the other day, she had diarrhea for 20 years after her gallbladder. I put her on a bile salt binder, she got better, her diarrhea got better instantly. So that's another thing to know. So much more to talk about gallbladder disease, but that's I'll leave it at that today, so now you're informed.